Hello, hello. Welcome, everyone. Thank you for joining us in this
Yeah, thank you.
first co-design session. As we
Thank you.
start, let's please uh, remind ourselves of the importance, if possible, to have our cameras turned on so that we can see each other, and trying to keep our microphones in mute, um, just to make sure that there is no background noise that could distract people. So, as I mentioned, this is the first co-design session as we move towards our dialogues. And let me move on to our next screen. We we already can see in the screen that these sessions are co-designed and facilitated by the Sabine Vaccine Institute and People Power Health. And the mission of the Sabine Vaccine Institute is to make vaccines more accessible, to enable innovation, and to expand immunization across the globe. This is our agenda for today. So let's just briefly go through the agenda so that we can all have a clear understanding of how this session is going to be run. We will have 20 minutes for welcoming and introductions. And throughout these first 20 minutes, each one of us will have the opportunity of briefly introducing ourselves and answering a check-in question that will prove really important as we go through the whole session. After those welcome introductions, we will have an overview of the climate crisis and its impact on health that will be shared by our dear friend and colleague Shrita Narayan. Once we finish that, we'll be moving on to a very specific section of this fall, which is understanding the experience of the Boost champions with the climate crisis, which will be facilitated by Dr. Petja Stojic. After that, we'll have a breakout room, two breakout rooms where we will divide you by regions. We will be recording those breakout rooms and we will be taking specific notes of your experiences. So please, let's be as engaged and as active as possible as we go through those breakout rooms. Finally, we'll be coming back to the main room where we'll be debriefing the top 3 notes that each group took, and we'll be talking about the next steps with the next session. And a brief overview of the dialogues and what this new project is going to be working with. The dialogues will be enhancing the understanding and equipping all the participants with a comprehensive understanding of this link that is between the climate crisis and health, specifically on the immunization programs that you all are working on. We will also have a shared experience because all of the participants will have the opportunity to recognize, to surface, and to examine that impact of the climate crisis on the immunization program where you all work today. And finally, these dialogues will be allowing us to strengthen the influence and the engagement of all of you in the climate crisis by bringing your knowledge and your experience to the policymakers. We will be having 3 co-design sessions. This is the first one where we'll be focusing on understanding the experiences of the Boost champions. Then our next session, November 27, we'll be focusing on co-designing the structure and the content of the dialogues. And finally, our third session will be focused on reviewing a monitoring tool that we'll be sharing with you in due time. You all have the calendar invites, and we hope that you will be able to join us in all of these 3 sessions. Okay, so brief introduction. I will show it myself, and I will pass it on to someone else. Hi, everyone. My name is Sam Gonzalez. I'm joining from Mexico. I'm currently the Director of Health Advocacy at People Power Health. And a really brief personal experience of how the climate change has impacted health and access to healthcare in my community. It has to be with heat waves. It's very clear in my community how heat waves have been impacting people not only in their health, but also in how frequently we see, especially kids that are affected by it. Now I will pass it on to Dr. Peja, and we'll be moving through the room.
Thank you, Sam, and welcome everybody. It's good to see you all. Some familiar faces, some new faces. That is always great. So my name is Peja Stojcic. I'm the Executive Director of People Power Health and faculty at Harvard School of Public Health. And my personal experience with the climate change and climate crisis is right now. Like I live in Boston area, in New England area. We didn't have any rain for the last kind of like month and a half. Everything is dry. Actually, today is finally raining after 2 months, and everybody's so happy. And it's so interesting because in this region, usually at this time of the year, in the past you can even have snow, but this year we didn't even have the rain, and you can see the difference and changes that are happening around us. And I will pass it to our colleague and friend Shweta.
Thank you,
Hi,
Dr.
everyone.
Pej.
Oh, okay. Hi, everyone. My name is Shweta Narayan, and I'm part of the People Power Health team over here. I'm a climate and health campaigner. I'm based out of India, but right now I am speaking from Japan. So I think while it's morning for friends in the US, it's late night for me. And truly, this is a global representation. For me, climate change and climate crisis is I live in a very small village in the hills in South India, and there's been an exceptional rise of infectious diseases, and especially viral diseases during the spring and summer. I mean, spring has been everybody enjoys spring. I'm assuming I'm a big it's my favorite sort of season, but of late last 2 years we've seen very, very high number of infectious diseases, people falling sick, even our pets falling sick. And so it's been a very anxious moment for me every year during spring. And in terms of the impacts on the community, because we're making so many hospital visits during spring, we know that hospitals are overwhelmed and their medicine stocks deplete significantly. So for me, that's my experience of the crisis. I am going to pass it on to Rita now.
Thank you. Thank you so much. I am Rita IE. I am a Lebanese nurse, currently serving as nursing director and also an infection officer in a facility in Lebanon. And I'm proud to be a member of People Power Health. For the impact of the change in the climate, since 1993, we didn't have like a cholera case, but recently we are living in an epidemic area of cholera, and all this is due to the climate change. We are lacking of water. Us in Lebanon, in the mountains, we are used to have lots of water, and now we don't have water. We are having outbreaks of cholera. Thank you, and I pass it to Ivana.
Thank you, Rita. I'm Ivana. I'm from Serbia. I am also the part of PPH, People Power Health team. About a personal experience, I will agree with my colleague Sam. The heat wave is definitely one of the biggest problem right now in Serbia. During this summer, we had a lot of heat waves, and even on mountains, we had like 40 degrees of Celsius, and it never happened before in the past. So we also had a lot of disease and viruses. So I hope here we will find some kind of solution. I will pass to Bilal.
Hello, everyone. Pleasure to be here. My name is Bilal Khan, and I'm the manager for program strategy and leading the climate change initiative at the Safe and Vaccine Institute. I'm based out of Baltimore in the US, but I'm currently back home in Pakistan. That's where I'm from. And as a Pakistani, experience multiple impacts of climate change. We have way too many things going on. We have droughts, we have floods, we have extreme heat. Right now, the city I'm in, which is Lahore, is immersed in smog, some of the worst smog that ever recorded. And so there's a lot that the population at large is facing, billions of people throughout the year. And my work has mostly been investigating the effects of floods on immunization. And that's what I researched back in 2023, investigating how the immunization program in the Sindh province of Pakistan was affected. And it was a great learning experience hearing from all the sort of immunization professionals working in the field, and the extent of helplessness that they faced during that process. So it's great to be here, and I look forward to learning from all of you, from your experiences and your insights. I will pass it over to Liz Colway.
Great. Thanks so much, Bilal. And hi, everyone. Welcome. My name's Liz Colway. I'm the director of the Boost community. Just wanted to, first of all, thank everyone for joining us for these co-creation sessions. We're really excited for this new offering for the Boost community and appreciate your insights and leadership on this dialogue series. So I'm from the Washington, D.C. area in the U.S., and I would say an example of climate change impacting health probably was last summer when there were a lot of wildfires in Canada, and a lot of the smoke actually made it all the way down even further south than Washington, D.C. So there were several days that we had to kind of stay indoors and avoid kind of being outside just because the smoke was so heavy. I will go ahead and pass it to Ed.
Thank you, Liz. Hi, everyone. My name is Edbert Bozil, and I'm a community manager with the Boost team. I'm not based in Haiti, but I'm from Haiti, and that's one of the most vulnerable countries to climate change effects. And Haiti's currently experiencing an increase in vector-borne diseases such as malaria and dengue and chikungunya. Yeah, I'm gonna pass it on to Tima.
Hello, Tima. I want to say, everyone, I don't speak English. I am speaking French. Can I speak in French? OK. Bonjour à tout le monde. Je me nomme Diabaté Tima. Je suis en Côte d'Ivoire. Et je travaille au niveau d'un département sanitaire qu'on appelle régulièrement district sanitaire. Et il faut dire que notre département est situé au sud de la Côte d'Ivoire et on vit au jour le jour l'impact de la pluviométrie. Surtout en ce moment même avec, on ne peut même plus dire en Côte d'Ivoire ici qu'il y a une période réservée pour la pluie et une période réservée pour la sécheresse parce que depuis un moment, il ne fait que pleuvoir chez nous. Et Bassam est situé entre, j'ai envie de dire, trois coups d'eau. Il y a la mer, il y a un fleuve qu'on appelle Sud Comoé, et puis il y a la lagune. Du coup, on reçoit tous ces flux d'eau-là chaque année et ça nous crée des déplacés régulièrement ces temps-ci, des déplacés qu'on est obligé de reloger, qu'on est obligé et de repositionner, ainsi de suite. Et avec l'appui des ONG, ça nous permet quand même de voir comment s'occuper des formes de déplacés. C'est des choses qu'on n'avait pas avant, mais aujourd'hui, on essaie de s'adapter, on essaie d'organiser des sites de réfugiés, on n'a pas envie de dire réfugiés chez nous, hein, c'est des déplacés. Donc, et aussi, chez nous, déjà, on était déjà en zone endémique avec le paludisme, mais avec cette pluviométrie-là, on a constaté que le taux de consultation a doublé, surtout, et le paludisme qui est la première cause de morbidité chez nous ici. Voilà un peu comment est-ce que je peux dire que les activités de santé chez nous en Côte d'Ivoire ici. Voilà, merci à vous.
Tima, merci beaucoup. But I will ask if Rita or someone can translate because we would love to. Some of us who don't speak French would like to also understand. And then, yeah, Rita, could you quickly translate? Yeah.
Yeah, sure. So, thank you, Tima from Côte d'Ivoire. Well, as Tima said, it's really a huge problem by the climate change, especially it's causing displaced people all the time in the country, and also it's caused lots of burn to the health system because they had floods, and also they are dealing with malaria, the paludism, and all those diseases that could be prevented if they didn't have all those displaced people. This is the major issue in Cote d'Ivoire.
Thank you. Paraclet, can you go next, please? Paraclet?
Yeah,
Oh, you are in mute.
Good day, everyone. My name is Paraclet Ugu. I'm from Nigeria. I work with the Enugu Primary Healthcare Development Agency. However, currently I'm in UK, advancing my studies. We actually have issue of climate change in our country. Lately, years, like 3-4 years now, consistently we'll be having cases of flood where it affects both the health and the environment, and the flood usually comes with vaccine preventable diseases, which needs to be addressed. So I look forward to coming up with solutions on how we can be able to deal with that. Thank you.
Thank you. Adornola, can you go first? Next.
Okay. Hello, everyone. My name is Adonla Oyegoke. I'm a field epidemiologist and technical officer for planning with Africa CDC Western RCC. Regarding climate change, I think in Nigeria, just to buttress the point that Paraslet said, there has been changes in disease patterns with diseases that have been happening, especially due to flooding. So with the flooding, you see increase in cholera cases because the water sources become contaminated. And also during immunization activities, you see the flooding affecting access to some areas, so which makes it difficult to get these life-saving vaccines to people in such areas. I'm happy to be part of this meeting, and I look forward to us designing effective strategies that would help improve the health services delivery. Thank you, and over.
Thank you. Ahmad Nusrat, could you go next, please?
Thank you so much. My name is Ahmed Nusrat. I am speaking from Pakistan. Basically, I am working as a school health and nutrition supervisor, and also have a experience of more than 1 decade in immunization field as a district master trainer, and and a sub-district level. I am supervising the EPI and National Immunization Day. As concerned with the resilient and the climate effect on the immunization, we do with all others. We have also affected from this the region where I belong, and my working place is suffering from two major climate changes, and that is the population which is living across the river. So whenever the type of flood comes to our immunization schedules affected from that, and the community which are living across the river cannot be vaccinated on the time. So when the flood downs, we may use sometimes boats and some other resources to go across the river, and usually it occurs from July to September. On the other hand, and the smog is also a big climate change in my region. And in the last week, our government shut down many of our activities in the region, that are the schools, markets, marriage halls, hotels, and restrict the timing. So this also impact on our immunization team for their working schedule. So we have to change and alternate the schedules of our immunization teams, so that they may vaccinate on the other regions and other areas of the country. So as concerned with this.
Thank you, Ahmad. For the next people, please let's try to keep in 20 seconds so that everyone can have an opportunity. Thank you. Ajit Kumar Singh, please.
Hi, Sam. I'm audible?
Yes.
Yeah. Myself, Ajit, I'm from India. I work in the Immunization Technical Support Unit, Ministry of Health and Family Welfare. I work as a research person in the immunization vertical. Right now, whatever I am seeing from the last 1 decade itself, the dual burden of climate is going on. At the same time, the floods are increasing. At the same time, the climate, it's like heat waves are going on. And due to that reasons, the vaccine uptake is going down in the peak season of the May, June, and July. Whenever we plot the graph plot of the vaccine uptake throughout the year, we will see the vaccine coverage deep down in the month of April, May, and June. These are the 3-4 months which the vaccine dipped down. The major reason, another also I have seen, in the future we have to see how the vaccines are thermo-resistant, how it because it lot of the temperature will rise in the future, and the vaccine wastage could also could rise in the future. We have to think in that direction, as well as the seasonal variation in the vaccine uptake is also one of the major concern due to the climate change. Thank you.
Thank you, Ajit. Dr. Arongset Mughal, please. Arongset.
Hello, everyone. Hello, everyone. Good night, good morning, good evening, as per your time zone. I am Aurangzeb Mughal, working as Deputy Director Immunization Program in Pakistan in the state of Azad Jammu and Kashmir, and also additionally working as a coordinator nutrition program. Just I want to tell that the climate changes are the major challenge in our area, where we have to face a flash flood sometime. And these days, smoke is a big challenge in our area. All these climate challenges affect our immunization program. Sometime cold chain supply is badly restricted. So this is the important activity for me to learn about the climate changes and its effect on our immunization program. Looking forward to learn more about the climate change effect on immunizations. Thank you very much.
Thank you, Arongset. And as we go with the rest of the participants, let's please remind to give a personal experience. Okay.
Okay, I can go if anyone else is not left.
Yes, please.
Okay, hi everyone. It is so first of all, I'm so happy to see Sam again, Prija again, Rita, then also some of my colleagues like Aurangzeb who were part of the ACAT training along with Ajit. So I and Ajit, we work in the same team in the Immunization Technical Support Unit here in Ministry in India. And he mentioned about the vaccine part. I just wanted to talk about the current thing that we are actually facing in the northern part of India, which is smog, a lot in pollution. And very interestingly, it is the thing that we are facing like right now. This is the time every year wherein the smog levels are like so high, particularly that this is the first time we have been given work from home because of the hazardous levels that it has gone, and it couldn't get more personal than that, honestly. Although it is not a permanent solution, but yeah, that is some relief it always gives you, that you are working from home. But again, it is something that it's also comes as a privilege. That is what I see. Not everyone can work from home, depends on what they're working in. Not directly related to vaccine, but yet it has impact on people, especially who are like in older ages. For example, they already are vulnerable because of the respiratory illnesses, and this has exacerbated it like to another level. So yes, so I'm happy to be here and like be able to contribute in the next few months. Thank you, everyone.
Thank you, Dr. Pretty. Elsa, can you go next, please?
Okay, thank you, Sam. Hi, everyone. My name is Elsabeth Megarsa. I'm from Ethiopia, and I'm working as a senior public health emergency management advisors, including vaccine preventable disease. Coming to the impact of climate change on health, of course, there is huge impact on the health. It has direct as well as also indirect impacts. Like we can see the spreading of the climate sensitive diseases, such as vector-borne disease. We can mention like malaria, chikungunya, also dengue fever, yellow fever, and others. Also waterborne disease like cholera and typhoid, which is very common in my country, Ethiopia. Even currently, we are in malaria outbreaks. So the last 2 years, we were in a cholera outbreak, which is related to these climate changes. Again, also it has impacts on the vaccine preventable disease because of the climate change and the high rainfall, and there is a flooding. It causes also landslide. Due to landslide and flooding, the health facilities will be disrupted. It causes also the interruption of essential health services, including also vaccination services and the immunization program. So it has huge impacts, the climate change on health and also the access of health services. So thanks so much, and happy to join you again. Over to you, Sam.
Thank you, Elsa. Marta, would you go next, please?
Hi, everyone. I'm Martha Ngwe from Cameroon. Sorry, I might not be able to switch on my video. So I work with the expanded program on immunization as the head of surveillance, monitoring, and evaluation. The impact of climate change is huge, as mentioned by the other members in the call. So it ranges from a natural disaster to disease outbreak. From my experience, so we've had landslides even in the dry season now. And also talking about disease outbreak, we have also what we call the seasonal malaria, where we have perennial chemotherapy and so on. And we also have diarrhea diseases that do occur at the end of the dry season and the beginning of the rainy season. So we have it cutting across. And also in terms of immunization, we have some of our sessions, like the outreach sessions, that are not being realized because what was planned was not what is actually happening. So we may have floods, you may have some other things that prevents this realization of strategies to meet our targets. So thank you.
Thank you, Marta. Sardar Wakas Arha, you next, please.
Hello, good to see you, Sam, again in this course. For me, climate change affect our country a lot in shape of floods, heat waves, and smoke. Like in current situation in Punjab, over one of our province, we have more than 70,000 patients per day influx in hospitals suffering from respiratory issues, and we have health emergency in our whole province. And as for concerned as floods in 2022, more than 32 million population of Pakistan suffered with flood, and they can't have any access to health or health related any facilities. And especially the climate change have a lot of impact like heat waves temperature more than 45 degree, and people cannot access to health facilities, or it is very difficult for them to move around. So climate affects our country a lot, and also that in this dialogue we can understand more things from your side.
Thank you for that. Munir, could you share, please? Next.
Good afternoon, all. I'm Munir Salisle from Niger State, Nigeria. You see, climate change issues it cut across the globe. Actually, in our own area, we have so many issues concerning flooding, cholera diseases, malaria, and even as of now, we have been fighting with circulatory vaccine-derived polioviruses that cut across. And then we also have cases of measles, which are not even expected at this time. Now, as we are moving down, towards dry season, hopefully we are expecting more cases of measles, which of course warrant the country now to adopt vaccinations for measles, which have just done it right now. So in summary, we have issues of flooding, devastations of our facilities, disruption of our rice sessions, and so on. All these affects across all the country. Thank you very much. I'm Munir Salisle from Kano, Nigeria.
Thank you. Thank you, Munir. Jamala Charlotte Corinne, please. Jamala? Okay, maybe there's a tech issue with your microphone. Is anyone in the room missing that I am missing?
Tina, I think, Sam.
Yes,
just
Tina.
came in.
Yes.
Tina,
Good
please.
afternoon. Good afternoon, Peja and everyone. Sorry, I had another meeting, so I just have to join you. So my experience with weather change and its implication to impact in immunization has been had a lot of made me to have a lot of resilience to address immunization challenges in my context. So the major challenges, like Munir has said, is about flooding. Flooding is really something, a kind of weather change you cannot withstand if you are to embark on immunization activities. For instance, in a community where I was supposed to go for a community dialogue, before we could get there, the weather had already changed. And before we could move further and thinking that the weather might be conducive, or we might be able to cross the big ditch, the big gully, to the other side where we are going to do the activity, the rain had started falling. And then the whole place, the whole gully has been covered with water. And this is something that we had already programmed, and we have informed the community we are coming. We knew they are rejecting the vaccine because of that same difficulty in crossing that gully to the town. They can't move. So what do? We had our vaccine carriers, we had everything with us, but the weather had changed, and we could not cross to the other parts to vaccinate, to deliberate with them and vaccinate those children. So weather change actually affected us on that day, but the resilient minds that we put forward that we must cross that part. If we don't cross to the other side to vaccinate those children, then this community will continue to be resistant to vaccine. So what we did was to hold our hands, call on the youth to hold us strong and pull us across the water. So when we crossed that water, the non-compliance immediately reduced. People were clapping, and immediately they accepted the vaccine. We could not even deliberate anymore because they saw the passion we had to cross that big water to meet them. So these are some of the things that we face as immunization professionals in our daily work. So weather can always make us to not reach children when we are supposed to be there. So erosion and flood is one of the issues. So also we have other weather storms that could come, like heavy winds, throwing away the health facility roof. Then you have to relocate to somewhere else. You have to rearrange your activities, make announcement again. This is where we are now. You know, the turnout becomes so low because those things, the weather has disrupted a lot of things. So there are a lot of challenges. Thank you.
Thank you, Tina. And thank you everyone for sharing your experiences. Just before we move on to the next section with the slides with Shrita, I would like to ask my colleague Bilal, if you'd like to share a
Sam,
reflection.
I think we miss one person. Sorry, like yeah. We miss
Okay.
actually two people. Go ahead.
Okay, can you hear us?
Quarterland wanted to, and then we have Okas.
Yes. Yeah. Can you hear me?
Yes.
Yes. Hi, everyone. It is actually I couldn't join the session earlier. I was trying and it was keeping me on hold. That keep waiting. The host is, I guess, busy on some other meeting.
Don't worry. It's fine. We are happy that you're able to join. Phil, please share with us your introduction and one brief personal experience that you have with climate change.
Yeah. Okay. First of all, I want to introduce myself. I'm Vikas Nasser, working as a assistant director in health department, government of Pakistan, state of Pakistan, Azad Kashmir. We belong to some area, that is being affected by kind of worse weather conditions. Sometimes it is flooding, sometimes it is, snowfalls in winter. And it is always very difficult, to make people get their children immunized in such conditions. And after that, we do not have that much good capacity to get back to the position, as soon as possible. Therefore, it is, and I believe that resilience, climate resilience is a kind of a tough job to deal with it, to get back to restore to the original position, to restore to the task we had. And we need to get a better strategy to overcome these climate conditions, to keep our children well immunized, to keep our coverage up to the mark, and to get things done. Thank you very much.
Thank you, Wakas. Kuratulain, are you able to share?
Hello, everyone. Assalamu alaikum. My name is Kuratulain, and I'm also working as an assistant director in the health department. Climate change is a big challenge in our country. As we live in the country where we have faced lots of challenges like due to climate change, as we have climate resilient healthcare infrastructure development, enhanced vaccine storage. Then we also have community-based climate change adoption. So the things we have studied are, we can say, vulnerable population, children, elderly, and those pre-existing conditions. And in my community experience is that increased frequency and severity of natural disasters, climate change in seasonal patterns affecting agriculture and food also, not only our vaccines. So difficult to maintain vaccination schedules during the weather, And we also see the challenges on
Kuratulan.
addressing preventable disease.
Yeah. Thank you. Thank you, Kuratulan. Okay, and now just before we move on to Shweta's slide, Bilal, would you like to share with us share reflection on the introduction that we just had, please?
Right. No, it was, I think, and I think a very informative experience, learning from all of you about the challenges and the impacts of climate change that all of us face. And I think the reality is that not one of us is saved from the effects of climate change, regardless of where we are. And I think the most important thing for us in this session, and then the next two sessions in the co-design, and then with the larger Boost community, I think is to surface some of these ground level realities, and for us to put that front and center in front of policymakers to say that action is required, more needs to be done. So I look forward to engaging with you all in this session, the next two as well, and getting your feedback. Thank you.
Thank you. And now we will move on to Shweta's overview, please.
Thank you, Sam. Thank you, everyone. In fact, I had prepared these very extensive slides, but as always, I believe that this group is a set of experts, and we have a lot to learn from all your experience, and we're already sort of beginning to do that. What I'm going to quickly in my next 10 minutes present is basically a consolidation of what we've already heard. My presentation is split in three parts. We'll talk about the climate and health, the climate crisis and the health impacts in the first part. In the second segment, we will look at some of the the root causes of the climate crisis, and it's important as health professionals, as health care members in this community. We look at what is the underlying reason why we have the climate crisis, and how can, as health community members, we can address those underlying reasons. And then in the third part, we will specifically talk about the role of health sector and immunization and healthcare professionals, how they can contribute in climate action. So starting with this phrase that you've often heard, and as a campaigner, it's my job to repeat. So I will never get tired of repeating the fact that climate crisis is a health crisis, because it affects air, water, food, shelter, security. And these are all the basics on which human life depends. So climate crisis is a health crisis. Next slide, please. And I think it's one thing, and this was very, very evident from everybody's experience today, that the fact is that the climate crisis is here. We are living it, we are experiencing it today. A lot of policymakers often assume or pretend to assume that this is a crisis in the future. We have more immediate needs right now, and somehow try to deprioritize climate crisis. And I think 2024 itself is a sobering reminder that we are living this crisis. We are being, our lives, our communities' lives are being disrupted by the climate crisis. And the urgency is now to address the reasons why we have a climate crisis. Next slide, please. Just to give one example of how far, and echoing what Bilal just said, no one is unaffected by this crisis. And I was just trying to put together a list of extreme weather events and disasters, and what we call as unnatural events, because these are all being caused because of the human activities and climate crisis. And this is just 2024. These are the list of extreme weather events that have happened in 2024 alone. We are in November. We still have one more month to go. So God forbid, we don't know what that month has in store for us. But again, not a single person, any part of the world is unaffected. The scale of effect will depend on how vulnerable those communities are. So if you're well off and if you have protection, you'll probably be able to cope with the disasters better. And if you are really marginalized, or you belong to a community that does not have enough resources to protect itself, you will see the impacts in much, much worse form. Next slide. So again, just sort of consolidation of what everybody mentioned today in their introduction about how climate crisis impacts human health. And we saw this collection of health impacts across from today's submission, from air pollution, from salination of water, from crop damage and malnutrition, increased vector-borne diseases, waterborne diseases. You will see extreme weather events and damages from there, and also in terms of social disruptions, migration, conflicts, more pressure on limited resources when communities migrate from their cities to another city. So you will see a range of immediate and long-term impacts in terms of human health implications of the climate crisis. Next slide. And I'm just going to move through some of the slides pretty fast because only because that has been covered in our introduction. Next slide, please. Temperatures is a big concern. A lot of you echoed that. 2024 is on track to be the hottest year ever on record, beating the records of 2023. And perversely, if you want to see, what we are experiencing now is the coolest summers or coolest years ever, because the future is going to be hotter, unless, of course, we take radical action to mitigate this crisis. And associated with temperatures are heat strokes, impact on populations, especially vulnerable populations, impact on healthcare infrastructure and its ability to cope with the increased burden that it will face, water scarcity, water stress, and we have seen that. We have seen, especially in South Asia, with in March and April being the hottest, with temperatures reaching 50 degrees Celsius, we have seen the impacts. In fact, some of the newspaper articles that I have read talked about people dying like flies and dropping dead. And that's the reality of the heat stress. Next slide, please. Again, a lot of you talked about both extreme weather events, including cyclones and floods, and droughts and associated damage. And we are all, I can safely say this today, listening to everybody's experience, that our lives have all been touched by at least one, or devastated by at least one extreme weather event in the last decade or so. I remember the trauma of dealing with floods in 2015 when I used to live in Chennai, and the associated disaster. And the interesting thing about extreme weather events is that these are not just the episodes of those flooding and those cyclones, but the disaster and after effects that lingers for months, because the effects, while the flood may be there for a week, but the impacts that it leaves behind, the devastation that it leaves behind, and the way it damages and destroys our lives and the lives of our loved ones is over a period of time. The damage that it, especially to health infrastructure, that extreme weather has, it sometimes takes years and even decades to reverse that damage. And that's very important, especially from a health professional perspective, for us to know. Next slide, please. We have again today heard increase in infectious disease. This was my personal story, that we are seeing increased burden of diseases, sometimes what doctors describe as unseasonal, but the unseasonal is becoming very, very common and more frequent. As a result, there is an increased burden on the already overburdened healthcare system. Next slide, please. I particularly included this slide because we need to understand that among us, while we are all vulnerable to climate-induced impacts, there is a vulnerable population among us that is particularly, and that needs particular care and concern. And mostly it's the women, elderly, and the children who are more prone and more susceptible and have a longer trauma and impact of the climate crisis. And sometimes and this is important also for us to remember, because sometimes when we are planning and designing policies, we have to deliberately make sure and intentionally make sure that our policies recognize these vulnerabilities and address these vulnerabilities adequately. Climate change and mental health is something that is now being talked about, but I still feel it's not being talked about enough, because the impacts, and again, it goes on to say that you could be impacted by a disaster like a extreme weather event for a few weeks, but the trauma lasts for years. And that manifests, that trauma and that mental health impact manifests in various kind of social disruptions, anxiety, depression, substance abuse, domestic violence. It can manifest in many forms which have tangible, again, health implications. So again, this is something for us to remember and take cognizance of while we are planning our healthcare systems. Next slide, please. Again, this is, I particularly saved sort of this impact for last because, again, we heard today a lot, especially right now when South Asia is suffering from hazardous air quality. So from Lahore to New Delhi to Dhaka, we are seeing air quality that, if our systems, our governments were adequately responding to it, this is a situation right now, what we are experiencing would actually require evacuation of populations, because the air quality is so dangerous right now. And even spending a few minutes outdoors can be absolutely lethal to health. And again, and in the next segment, I will talk about the root causes. So again, I don't have much to say because I think the participants have already spoken a lot about air quality. Next slide, please. This is just, I wanted to demonstrate the visually how bad the air quality, and this was about 6 years ago. We had run an experiment in Delhi where we had put out these HEPA filters with fans that mimicked our lung function. And on day 1, you can see the filters were white in color. And by day 10, these filters had turned black, indicating that in 10 days, if artificial lungs that mimic our lung function could turn black, what impact it would the dangerous air quality has on our lungs and our children's lungs. And this is just a visual demonstration of that. And that speaks everything about the dangerous air quality that we are breathing in right now in South Asia. Next slide, please. I want to quickly, again, and this is where I want to talk about the root causes of the crisis. And it is well established, science is very clear that it's our dependence on fossil fuels, coal, oil, and gas is driving the climate crisis. And when we are talking about our dependence to fossil fuels, it's not just about burning of fossil fuels. Throughout the life cycle of fossil fuels, so from exploration to production to consumption and disposal, we are affected by its negative impacts, and that is also driving the climate crisis. Next slide. And I want to just quickly cover some of the points why we need to consider about fossil fuels. And one of the main impacts of fossil fuels burning, which was evident earlier, was air pollution. Air pollution nearly causes 8.1 million premature deaths every year. And these are not just numbers. These are people, these are mothers, fathers, children whose lives are prematurely lost because of the adverse impact of air pollution. But air pollution is only one of the health impacts that we see from fossil fuels. Next slide. We've also seen that there are several other documented health impacts. In fact, if you look at the range of documented health impacts that we see from fossil fuels, it's very clear that not a single part of human body is unaffected because of its dangers. So the chemicals released in the entire life cycle of fossil fuels cause reproductive damage, they cause respiratory damage, they cause cancer, they cause neurological damage. Not a single life cycle, in the phase of human life cycle is unaffected because of, and that's why fossil fuels become so dangerous and it's so urgent and important to tackle the fossil fuel crisis. Next slide, please. We are also, so pollution is one aspect of the fossil fuel crisis that we're seeing. The other aspect that we see is the social harm from fossil economy. And we often see that fossil fuel industry cause human rights abuses, post-displacement of communities. They cause social disruptions, gender-based violence, and all of these harm that they are causing has an impact on our health system, in the community. And the reason why it's important, so we are talking about climate crisis. Fossil fuels drive the climate crisis. We're seeing the impacts of the climate crisis on our communities. And on top of it, we also see the impact of the consumption, our addiction to fossil fuels in the communities. Next slide, please. And these slides are all available for everybody, so I'm happy to answer any questions. I do understand that there is a time restriction. I would skip this slide and go to the responsibility of health community, because I think we have discussed the problem a lot. I think the health sector and the health professionals, especially immunization professionals, have a unique opportunity to contribute in climate action and to improve people's health and address the climate crisis. And this is also to understand that in this crisis, there is an opportunity. So while it's a very it's a critical condition, it's a critical situation that we really need our attention. I feel that the health community has an opportunity because the health community has tackled similar crises in the past, be it with occupational diseases, with cholera or respiratory illnesses, or any other social issues that the health community has tackled in the past. So the climate crisis, in a way, is an opportunity for the health community to organize and lead by action. So for the immunization professionals, given that their close connection with the community. Next slide. And next two slides are sort of text heavy because I've sort of tried to list out what are the different ways in which the immunization professionals can really contribute to climate action. And the gist of these two slides are basically, as immunization professionals, as the trust that community has in the immunization professionals, they can be the immunizations professionals can be the link between the community and the policymakers. They witness the harm that community is suffering because of the climate crisis firsthand. Many immunization professionals are also part of the community, so this is their lived experience, which when articulated in a scientific manner, when documented powerfully, has the power to influence health policies, design policies that safeguard community, and also tackle some of the root causes of the climate crisis. This can be in the form of documenting and reporting harm that policymakers often don't have a first-hand experience of. This can be by adjusting and adapting, which is also important, equally important, to the changing climate patterns in terms of delivering services, but most importantly, bridging the gap between the community and the policymakers is the crucial responsibility that the immunization professionals have. And we must leverage on this strength and this quality of this community to demand a change, to bring about a change. Thank you very much, and I'm happy to answer any questions later.
Thank you, Shweta. Thank you for that broad overview. And now we will be moving with Peja, who will be sharing with us the next part of this call.
Thank you, Sam, and thank you, Shweta, for the great overview. And I echo what you said at the beginning. We already heard from people things in a really profound way, and I want to thank everybody for participating. So, Sam, if you can, let me see if I can share my slides here. I don't have a lot of them, but I just want to make sure that we see something here. But wanted to start first by actually reflecting on the process of dialogues, like why we invited you to be in this. Some of you participated in the community activation trainings, but maybe you don't remember that at the very beginning, like long time ago, when we started that program, we actually had a dialogues first, because we do believe, like at Sabin and People Power Health, that nothing should be done for people without the people. And the first question is like, who are the people, and how do we understand their experience, so then we can build something together. And that is the idea of the dialogues as well, because we do want to see an engaged Boost community in understanding what is the current experience of the climate crisis, how does it affect immunization, and how that can then be translated into some concrete action that we can take together. So in the context of immunization, and Sam, if you can share the slides, I for whatever reason, Zoom is not allowing me to do that, but you know. So when we think about the experience in the immunization, if you go to the next slide, we thought we needed a couple of examples to start this conversation, but even in the intro, when people were introducing, I don't think we need more examples. We've already heard several examples, but I can give two that we have here. One is from Sao Paulo, Brazil, where the temperature heats and the heat waves affected how vaccines were refrigerated, and literally because there were power outrages, like people were losing vaccines. And it was a clear example that it's not just like it affects people who can get it, but it also affects the whole process of vaccination in many ways. The other example from the Western countries, like from Paris and from other places, where you have tiger mosquitoes right now showing up, and then you have a need for immunization that was not traditionally implemented there, and then you have that coupled with the vaccine hesitancy and misinformation that was happening during the COVID era. So with all these things that we see, and you gave us, like, Tina, I love your example of kind of like how during the floods you crossed the river, and that gave people hope that like even despite of the things you were actually dedicated to deliver vaccines to the community, and they were able to see that and witness that. So what we're going to do in the next half an hour or 20 minutes is to split into the breakout room. Sam, if you can go to the next slide, and really look, no, previous slide, sorry, and really look at the different stages of immunization and critical steps like vaccine storage and transportation, accessibility and distribution, increased demand and outbreak control, community engagement, education, funding and resource availability. These are just like a couple of things that we listed as part of the process. And we want you to take a look together and discuss, like in each breakout rooms, there are a couple of questions, but really going now specific to the examples of the effect of climate on your own experience doing immunization and delivering immunization efforts, either what you have seen or what you heard from your colleagues who are doing this work. And the reason why we wanted to start the co-design sessions with that is to use even this group to learn from each other. But then that will inform next week when we gather and we show you the curriculum of the dialogues, that you have a sense of kind of like, okay, these are the places where we can intervene to get even more information and conversation with our colleagues who are going to join us in January. So we're going to split into two breakout rooms right now. Basically, there will be two sections, like two set of questions, like 10 minutes for two questions, like how is it affecting the process of immunization? And then the next 10 minutes will be about what do you think, who are the stakeholders that needs to deal with this and potentially get us ready and prepare. Sam and Shrita are going to facilitate these breakout rooms, so you will have someone in each of the rooms. And then we're going to come back for a little debrief, and Sam and Shrita are going to give us like top 3 things that were discussed during the breakout rooms. Again, this is just the beginning of this conversation, but let's get started and let's hear from everybody, because that's the point of the co-design sessions, and it will be the point of the dialogues when we do them in January with a broader community. So Ed, or I don't know who can help us go into the groups.
Yes, Ed is just opening the rooms, and we'll be sharing the questions. Thank you.
Yeah. Welcome back. Good to see you, Munir. Good to see you.
Thank you very much, sir. Hi.
Tina, I have to learn more about that crossing the river. That felt like a really powerful story.
Hello. Yeah, I can't hear you, right?
Yeah,
Hello?
we can talk later. We'll reach out.
Later, okay.
Okay, sir. Okay. Hello, Munir.
Yeah. Welcome.
Tina, how are you?
Fine, thank
Hi,
you. Good to see you.
Yeah.
Welcome back. I think we have a few more.
Yes.
Everybody will be with us just in a few seconds. Okay, I think we now have everybody. Well, thank you all. I've kind of been in both rooms, and I was really blown away by the engagement and what people were sharing and how practical we went so fast. Just to kind of like close us together, like here, there will be more opportunities for this. There will be more time for that. That's point of the dialogue, is to go deeper. It seems like scratch the surface. But I would like to invite Shrita and Sam just to share their top kind of like things that they've heard. Shrita, starting with you, and then Sam can go after that in the next couple of minutes.
Thanks, Peja. I mean, we had a very, very engaging, and I really liked the conversation. I'm sure my colleagues in the group would echo the same. I think there was very clear articulation of the kind of impacts that we're seeing already on vaccination in terms of delays or dropouts or increased instances of vaccine preventable diseases. One thing that particularly stood out for me was this experience from Ahmed from Lahore, was about the whole counterintuitive way in which our planning system is right now. We have a smog problem. We had an air pollution problem where the advisories are going out to protect your children and keep them indoors so that they're not exposed. And at the same time, we have vaccination programs which are inviting parents to bring their children to the vaccine center and get them vaccinated. And this just doesn't make sense. Like, what do parents do? They protect their children and keep them indoor, or should they get them to vaccination center? So, I mean, things like this is just really important. And what was also, I mean, we took a little bit of an extra step and went deep into identifying where were the barriers, why are we seeing these kind of impacts. And there are 3 clear outline, and just quickly going to summarize. One is the fact that, I like it how it's different layers. So it's from a community level, people prioritize, I mean, after disasters, the priorities clearly are not vaccination, though it should be. So there's some way a shortcoming in the planning of popularizing or making people understand the seriousness of vaccination. Yeah. From a policy-making perspective, the policymakers are not on ground, so they don't have the ground reality, and they're not adept in adjusting to the ground reality. And finally, the fact that health is sort of a shared subject in planning and policy making and requires intersectoral coordination. And we're seeing the failure of that intersectoral coordination, as a result of which we are seeing immunization professionals facing these challenges. So I think it's very clearly outlined, and this makes, I mean, I have an idea, but I'm going to hold my ideas because I always have a million ideas, but I have an exciting idea to follow up from this.
Yeah, there will be more ideas. That's the point of the dialogues, I think. Sam, go ahead. What about your group? You had some wonderful conversations as well.
Yes, in our group, there were lots of great comments, but especially one thing that resonated a lot was how the climate affects how people can move around. And there are some hard to reach areas. That's another one of the most important comment that we had. We also talked a little bit about the cold chain and about the air pollution, but specifically the part of how women and children are most affected in our communities, and how the flooding, the landslide affects the transportation and the reach to reach people. That was the most important part. Peja, back to you.
Thank you, Sam. Well, let's give everybody a round of applause for amazing first conversation. As you will see next week when we gather, we're going to show you and present to all of you how we were envisioning the dialogue in January, like how we can have these conversations not with this small group, but like with a larger group of about 200 of our colleagues. So this was already just a preview of how powerful it's going to be and how much voices matters here, and your voices matter here pretty much. So next week we're going to shift gears. We're not going to talk about the specific impact of the immunization, but we're going to co-design together how we can engage other colleagues, like 200 of immunization professionals in January, and we're going to present the process for that. And we would love to hear your feedback because we want that to be the powerful experience for them, but also to allow us to turn these voices into a power for change, as Bilal was saying at the beginning. Thanks everybody for participation. Looking forward to see you next Wednesday. So we are seeing each other next Wednesday. It's not next Thursday, and then we're gonna take it from there. But thanks, Sam. Thanks, Rita. Thanks, Bilal, Liz, and Ed, and Ivana for amazing facilitation here.
Thank you, everyone.
Thank you. See ya next week.
Thank you.
Thank you so much, everybody.